Appreciate you taking the time for the webinar today. I'm Don Green, founder and president of TherapyMate. And today joining me is Mike Simonton. He's the senior sales director at Clinical Notes AI. What is the need for AI? There's several reasons we've listed here. There's probably some more, but these are the main ones. We want to reduce the amount of time you're spending creating clinical documentation. I know that takes a significant amount of your time. Some clinicians will spend 10, 15 minutes on a note. Some spend a lot longer than that. And clinical AI will definitely reduce your spend time on creating notes. We want to improve the content quality of your notes. To create a note, you want to put it in clinical terms. You're not trying to put word for word in the notes of what you and the client talked about. And sometimes after you've finished the session, relying on your memory can be somewhat of a challenge because you're trying to remember everything that occurred in that session after an hour and formulate it in such a way that it makes sense in the note and would be acceptable to, for compliance reasons. So relying on your memory won't be quite as important. You'll be able to improve patient outcomes, reduce your burnout from trying to get notes done, scheduling and seeing patients, and then realizing at the end of the day or at the end of the session, I still need to do the note. That can be stressful. And then we want to make sure you're meeting your compliance standards for your insurance companies and billing providers. So that's the main reasons. Go ahead and go to the next one. So the solution is to use AI. AI will listen to the audio from your session with your client and allow you to transcribe it into beautifully generated clinical formatted notes. You can open a note template, click on the widget, and you can start having your computer listen to the session, whether it's an office visit or it's a telehealth session, and you can start just relax and listen, do the session. And then when it's over, we'll show you what it takes to generate that note here in a minute. Go ahead and go to the next slide. Here's a couple testimonials if you haven't seen them already. We had some early adopters who tried Clinical Notes AI out in May and part of June. All of those people who were part of the pilot have continued using it and have almost all their staff using it as well. What we want to do now is we want to break and do a role play. We're going to simulate a session. So Mike's going to be the patient. I'm going to be the therapist. And Mike's going to bring up a note template, a standard progress note. So the process is you bring up one of your note templates. And these have to be one of the note templates that TherapyMate provides. He'll share that with us in just a second here.
Yeah. And even before that, Don, I think we have a poll for everybody to kind of make sure what we're hearing about the challenges that folks are running into. We just want to make sure we're hearing from
Oh,
you as well. I'll go ahead and share that
that's a good idea.
form with you now in the chat, and then I'll also share it on the screen here so we can see what everybody's kind of dealing with. This is our second webinar for the day today. So some of the responses that we actually have was from our earlier folks from this morning. So if the form is hopefully coming through and everybody can see it, if you wouldn't mind, we'd love to hear from you about just what you're running into. And again, the link is in the chat to get to this particular form, really just asking you kind of what are you guys experiencing today and where's the pain of note taking for you? So we'll wait a minute or two and just let everybody start filling out the form for us. All right, we're already getting some responses there. I think this is kind of what we saw earlier today too, Don. And it was really about it takes a lot of time. People have to do it. They don't enjoy doing it. They want to provide therapy to their patients and their businesses. So I think we could probably from there, Don, what do you think? Should we just go ahead and show everyone how it's done?
Yep,
Do our role play?
sure.
I'll go ahead and kind of start showing the dashboard a little bit. Don, is it coming through on your side? Can you see it okay?
Yes,
Okay, good deal. So again, everybody's a customer of using the TherapyMate platform. There's a couple of different ways to get to your particular patient. A lot of folks will just come to their calendar and they'll have an appointment booked. What I've been doing is just going into a client, and we have in this particular example a couple of patients in here that they're just fake data. They're not real there. So anything that you see here isn't violating any sort of HIPAA or patient identifiable information, but it's just going to be a person or a client that we're going to show here about how the platform is going to work. I'm going to go into James here, and you're going to go to the notes and documents section that I have here. We're going to go ahead and just do a standard progress note. And once that is selected, you're going to see a few things kind of pop up here. Now, the first thing that I want to show you is the top right hand corner. You're going to now see this little widget for those of you that end up wanting to use and try out the Clinically Notes AI widget and part of the feature to the platform. So there's just going to be a little box or a little round circle widget. You just click that, and now you can see that it's hearing me talk. There's a little bit of a light or some lines lighting up. There's ways to do live sessions as well as dictations, and so we'll start with what is a live session. A live session is a conversation that you may be having with your patient, or if you're doing couples therapy, etc., in the room, or if you're doing any sort of virtual care or telehealth, whether you're using maybe a platform like Zoom or anything within TherapyMate itself, and you're providing that care over the internet, we support that as well. So that's going to be the live session. It's always on. You can think of those sessions of lasting up to 3 hours to kind of capture that conversation. In a live session, we again don't keep a recording of the conversation. We're just taking in the conversation in real time and being able to transcribe it quickly when you finish up your session and generate your particular notes. So that's the first piece about a live session. Next, we're going to go to what is a dictation feature. A dictation differs from a live session as it's more or less like a summary of the session that you just had with your particular patient. That does not require what we often get asked about is consent. Consent is required for live session capture. It can be given in writing or it can be given verbally. We're going to cover consent a little bit more later on so you can kind of see what that document looks like and just other ways to kind of talk about it to get consent. For today's example, we're going to actually look at this particular progress note. And the one thing that I always like to do is have my goals and objectives also laid out here below. Anything that you see in the form here in just a minute, once Don and I do our particular role play, you're going to start to see this page light up as the AI starts doing what it does to fill in your notes for you. So that being said, I think, Don, we're probably ready to jump into our role play. To summarize it for everybody, what we're going to do is I'll be the patient today. I'll have a little bit of anxiety and maybe some substance use abuse through alcohol. And so again, we're going to go ahead and start the session right now. Because we're over Zoom, I'm going to use this little telehealth option here. I'm going to share my screen to allow that audio to come through for both me and for Don. Once I end up sharing this, I can go ahead and start my session. Now you can see the start button is lit up. And as soon as I click start, you're going to see this little red button start to flash as well. So now we know that this is listening to me. And Don, if you wouldn't mind, could you do a little test 1, 2, 3 to make sure we're working on your side?
Well, 1, 2, 3, 1, 2, 3.
Okay, we're good. All right, Don, you're my therapist of the day. Let's go through our conversation.
Okay. Well, hi, Mike. I'm really glad you came in today. Last time you mentioned that anxiety was getting heavier, especially at night, and have some things from the past week occur.
Yeah, it's been really rough, Don. Honestly, I've been drinking way more than I want to. It helps me fall asleep, but man, the next day I feel worse. I feel jittery, and honestly, I feel pretty guilty.
Well, thanks for being honest with that. You are noticing that it gives short-term relief, but the after effects, both emotionally and physically, are adding up to the anxiety. Is that correct?
Yeah, exactly. I mean, yeah, it's spot on. I feel like it's a cycle. I feel super anxious, and honestly, I drink to calm down, and then I wake up feeling anxious about drinking, and gosh, I just keep doing it.
Well, that loop is something a lot of people face. It makes sense. Your brain's just trying to get away from the discomfort, but it sounds like you're at the point where drinking isn't really happening or helping anymore.
No, I mean, I used to have one or two drinks just on the weekends, but now I feel like I'm drinking most nights during the week, and I don't like it anymore, and I just don't know what else to do when it gets this bad.
Well, that level of awareness tells me you're ready to start shifting things, and we don't have to change everything at once. We can take this step by step, looking at what's fueling the anxiety and building out strategies so the alcohol doesn't feel like the only option.
Yeah, Don, I really want that, and I'm just scared of how hard it's going to be.
Well, that's totally valid. Fear is part of the process, but you're not doing it alone. Let's get some treatment goals together. Nothing overwhelming for this first phase. How does that sound to you?
I mean, it sounds great. What are you thinking as far as goals?
Well, number one, let's track your anxiety and alcohol patterns, just noting them down without judgment. And then learn 1 to 2 new coping skills to help you manage anxiety in the moment. And then let's explore support options like group therapy or even medication, depending on what we uncover.
Wow, that sounds manageable. Just focusing on the next step.
Exactly. And I'll check with you each week. We'll look at what's working, what's not, and we'll adjust. For this week, I'll give you a short tracking sheet, nothing complicated, just day to day mood, just time of day, mood, what you were feeling, and whether alcohol came into play.
Okay, that sounds doable. I think writing it down even might help me slow down a little bit in the moment.
Well, that's the idea. Increased awareness is the first tool. We'll also start practicing a breathing technique today, something you can use at night when your anxiety spikes. Over time, we'll build up a whole set of tools you can rely on instead of the bottle.
Yeah, I've never had that. I mean, just from a tools perspective, I just sort of white knuckled it until I couldn't take it or do it anymore.
Yeah, you're not alone in that. But now we're building something new, one small win at a time. The goal isn't perfection, Mike. It's progress and self-compassion.
Yeah, I think I'm ready to give it a real try. Done.
Well, that's all I ask as you try. Let's focus on the foundation first. We'll check in next week, go over the log, keep building from there. And if things feel overwhelming at any point, just say so. We'll slow down and recalibrate together.
Done. That's great. I really look forward to it. Thank you for that. All right. I went on ahead and selected end. And as soon as you do that, and again, Don, thanks for going through that together. We now see a number of the items in the page or this particular note, including the goals and the objectives, are starting to light up and flash. You can kind of see a little bit of a purple or a red hue to it. We support any of the pull downs that you can see here, as well as just general text fields and bullets. So again, all of that is going to be now available at your fingertips. So as you scroll down, you'll see some other fields that are going to be recommended. Once I see all of that lit up, you simply click Generate Fields. What now is happening is the platform is analyzing that conversation in real time for what Don and I just went through. As that ends up finishing, you're going to start seeing some data put into our notes. If you have longer sessions, let's say you're doing over an hour, this could take just a little bit longer, but nothing too lengthy. You can now see that I've already have the data input into the notes, including some of our checkboxes are going to be filled. We also have some goals and the objectives that Don highlighted for me. So we wanted to do daily tracking of mood, etc., tracking how much alcohol is being taken in, and when are we going to check back in on that. There's also additional data on your plan. So all of this is now available. What we'll do is go ahead and hit confirm. And now your note is ready to go. You're ready to sign off and share. You can also go back and read any one of the notes that you have. For an example, in here, let's say I just wanted to add something extra. You also have the ability to kind of type in any notes that you want to do as well there. That is how it works at a very high level. So I'm going to take a pause for a moment. And Don, I'm going to go ahead and stop the screen share here for a little bit and go look at the chat. But we wanted to open it up. If everybody or anyone wants to come off of mute and has any questions, we'd love to hear from you.
If you have a comment or question, you can take yourself off mute.
So I have a question. So I do a session. I use this auto-generated. I'm going to go into my next session because, right, I don't always have as much time as I would like between the two. Can you then move into another session, or what is the delay before you can start another note?
The answer to that question is, so if I heard you right, we're going into a session, you're in the patient record, you're going kind of back to back. How quickly can you go? As soon as you select end, you can move on to the next one. And so it shouldn't take very long. You should be able to, within 60 to 90 seconds, even in some of your longer sessions, maybe even in intake assessments, you name it, that will be the amount of time that it would take from note to note if you're doing a live session. If you're doing a dictation, which we can show you that as well here in just a couple of minutes, that's usually just a 2-3 minute conversation. The processing goes quite a bit faster just because it's a shorter amount of time. Does that answer the question,
It does.
Michelle?
Thank you. Yes.
Okay.
Thanks.
Good deal.
We have a
Yeah, good
follow-up
question.
question.
Yeah, go ahead. I heard somebody else out there.
It was me. I have a follow-up question. Okay, so my question is, if so you hit say, or you hit the done button, do you have to also save the note in order for it to save
Yes.
the information and move on?
That's right, Yvonne. You nailed it.
Okay,
Just
so
as if
if
you're
you forget,
typing.
it's gone.
Yeah. You
Okay.
have to go back and either redo it or regenerate it. So yeah,
Okay.
you definitely want to make sure you save it, just like you as if you were typing it up.
Okay.
Yeah, good question.
I have a few questions. First of
Yeah, go ahead,
all,
Marion.
the consent, is that something we draw up ourselves, or you have a consent form as part of TherapyMate? And do we need consent each time
It's a great
have a
question.
session?
Yeah, Don, if you want to bring up the form, and I can answer, Marion, your question there. So, Don has a form in the platform. He'll show you an example of that. What we've found is that you can either do it in one of two areas when you're doing the live session. You either do it at one point of just signature, and we'll show you a form of that. The second way is to get verbal consent. What a lot of folks will say is to their patients, I'm going to be using a tool to help me with my notes. It doesn't record anything that we say. It's just a tool that helps me with my note quality. Are you okay if I use it today? That example goes really well because it doesn't say the words or the term AI, the abbreviation's AI. It doesn't have to say artificial intelligence. You don't have to do that. It's just a tool that's available to you to help you with your notes. What you're seeing here, we'll kind of kick it back over to Don. Don, is this the form that you have, and can you walk the folks through it?
This form is already in there for you. You can send this to clients and they can opt in or they can opt out of using AI. So this document is already available to you to use. So those patients that you feel like you want to have a written agreement rather than a verbal agreement, this is something you can utilize. And it's already in your documents and questionnaires in the client portal. Now in TherapyMate, I'm going to stop sharing a minute, and I want
Where did you need me to go there, Don?
just go to the test patients information page, click on James there, and then scroll down for me. So at the bottom of this page, there's a checkbox. And so those patients who have opted in to AI, you can check this box Go ahead and check it, Mike. And then save it. Now go to the dashboard and schedule James for an appointment.
Okay. How's that look, Don?
That's great, thank you. So as you're looking at your schedule throughout the day, there's a little badge on it right next to the patient's name that says AI. So as you scroll down your schedule for the day, you'll be able to see which patients have opted in and which ones have not. So there's not much of a danger of you using it when you're not supposed to. Okay, let's take the next question, Mike.
Yeah, sounds good. Catherine also had a question about billing there at the end. Don, did you see that?
I guess what I think you mean by that is that when you get done with the note, it has the necessary fields in the note completed so that when you go to do your billing, any billing information from the note will be included in the billing file. So um, what I see sometimes happening is people will complete the notes and forget to do certain portions of it that are necessary to do the billing. And this will help to eliminate or alleviate any problems so that when you go to create a claim and send it to the clearinghouse, you have a greater chance of being successful the first time. So there was a question about HIPAA compliance.
Yep.
So they're both HIPAA compliant, both TherapyMate and Clinical Notes AI.
Yeah, and Anita, that's a good question. The offering that we have with the platform is a 2-week no risk trial. So if you'd like to opt in for giving the platform a try in the future, the 2-week process, you can kind of pick a tier. There's 3 tiers available for you to select. The differences in price just compares to the amount of times that you're going to be using the platform and the credits associated with that. We'll have in our follow-up sort of what that's going to be is the easiest path to kind of get that trial started. We're going to have a form here just in a second as well for anyone that wants to kind of get going right away. You can also let us know and we'll get you set up on that 2-week trial. Don, do you want to maybe talk a little bit more about how folks could sign up?
Yeah. So Anita, we could provide you with some copies of some samples, but I think what you'd benefit mostly from is signing up for that trial and actually doing a session with the client just to see what happens and how it works for you. To get started with Clinical Notes AI, a system administrator for the practice goes to their practice settings, and about halfway down the page in the practice settings, there's a link or an option for AI. And you click on that, and you're going to see the different pricing levels. Each pricing level allows you to do so many live sessions versus dictations. During the trial, you can just pick the lowest one just to start out with. And then you'll see a list of your staff members if there's more than just you. And there's a little switch you can turn on. And so if you turn that switch on and save it, then anytime you open up a standard TherapyMate provided note, you'll see that little colored badge in the upper right hand corner of your notes page, so you can start generating, start capturing the conversation to generate your notes. So it's really easy. Once you turn it on, all you have to do is open a note template and then start your session and let the computer listen to what's going on, and then you can generate it. So startup time is very short. Catherine was wondering about what video program to use. I think she's talking about maybe telehealth programs.
Yeah, so like Zoom or Google Meet or whatever you have in your platform, Don.
Yeah, they could use our platform, they could use Zoom, they could use any other HIPAA compliant telehealth platform, and it will work with those as well.
Yeah, and then Karen I don't know if you want to come off of mute or if you're able to. You're talking about assessments, and what assessments were you referring to? Is there anything top of mind for you for that?
No, I guess I'm just wondering, I guess dictation would maybe be the thing for assessments. I don't know. Um, we haven't done assessments in TherapyMate yet, so I'm just not sure if it's in there or if there's a way to do it or, you know, that kind of thing.
Yeah, any of the forms, Karen, that are in the platform are able to leverage the live session and dictation feature. So depending upon the type of assessment that you're doing, the way that you're trying to get that information into the platform itself, it absolutely supports just about any document type that you're going to have that has an either like a text field or a check down or a bullet box or bullet points, any of those things should work for you. So
Okay.
I do with a number of other clients, assessments absolutely do work 100%. It's just the form itself would be different. But yeah, absolutely. If you enable that, let us know, or if you need help with that, Don and his team can help you set that up. And then we can also help you with the trial and make sure that that gives you what you need for the assessment form that you create.
Thank you.
So
Yeah,
the,
you're welcome.
so the 3-hour session length is related to Clinical Notes AI. TherapyMate's built-in telehealth feature does have a limit of 75 minutes max. So there are different timeout figures based on which feature it is you're using.
Yeah, I mean, the other thing on our side too is a lot of folks try to use in small group settings. They may be in that 90-minute longer sessions and things like that. We often get asked, well, if I'm going to use a credit for a live session, how much time is the max amount of time? And 3 hours is that number. So hopefully that helps, Catherine, with your question there.
I have two more questions. You said a group, and then that made me think of another question. But so my first question is, okay, so if you use the feature to create a treatment plan, will and then you go in to do a standard progress note the following week, will it still auto-populate the treatment plan from that you've already created, or will it create goals based off of the session, the current session that you're doing?
So we still
So it sounds like you're asking about some contextual history, I think, Don. Are you hearing that too, or what do you think?
yeah, we still recommend you do a treatment plan with goals and objectives first. And then those goals and objectives will carry over to the progress notes. If you need to add a goal and objective to a progress note, you can open up those little boxes during the AI session and it will populate those boxes, but they will not populate backwards to the treatment plan. They just
Okay. But what has already been created in the treatment plan will auto-populate in the note after it's created. It'll still work the same way.
Yeah, so let's say you've done a treatment plan, you've got goals and objectives on it, and then the next session you open up a standard progress note. When you open that progress note, you're going to see the goals and objectives from the treatment plan right then.
Mm-hmm.
If you want AI to try to create new goals and objectives during that session, just open some more boxes on the note for goals and objectives. And if it detects some additional goals and objectives, then it will add those when you generate.
Okay. And then my second question was utilizing this for when I have, say, like a couple. Do you know if if AI is able to detect who's talking and who's and things like that?
Yeah, I can work like that, Yvonne. So a lot of the times what a therapist might do is say, I'm with Jack and Jill today, having our third session, and Jack, would you like to get going? Something like that. Normally it'll up to about 5, then it starts kind of hallucinating. but in those smaller groups, it'll actually, when I say hallucinate,
Yeah.
it gets lost in having the ability to understand like 10 or 20 people. We haven't found a platform in the world for what we've been doing that can do more than five. And so that's kind of where our cap is for what that is. But in your question, absolutely, it will understand person one, person two, person three, and understand who's the clinical person versus who's the patient. A lot of the times, though, just in your conversation to make it an easier user experience for you, to maybe where you don't have to type so much after the notes generated, you'll often just say, I'm with Jack and Jill today, and we're here for our Monday 10 o'clock session. Let's get back into it. And then you're off and running. And I found that that's a good best practice.
Okay. And would you need to do that? So you would do that at the beginning of your session, okay? And then would you need to continue to say, okay, Jack, do you have anything to say? Or Jill, do you have anything to say? It should it should be able to auto detect
Yeah,
who's
it'll
talking.
start understanding the tonality as well. So when you heard my pitch go
Okay.
up and down, the system will also understand tonality. Other things that you'll also want to know too is if you kind of have that little bit of banter to get the day going. How's the weather? Favorite team, whatever it is for you. We want to take that data and kind of move it to the side. So the platform will understand what's clinically relevant versus just kind of general conversation. So you can get it going and started right away and know that the system will kind of understand that, hey, that's just Yvonne talking about her plants,
Oh,
her
okay.
favorite plants.
Okay, cool.
You got quite a few back there.
Yeah. This is my first time having so much success, so we're keeping them going.
It looks great. It looks great. And then, Catherine, I'm sending you a direct number. Sorry again that you're having some issues there. We can give you a call directly after this.
Okay. Other questions?
Yeah, there's one about just, Don, where in the platform can you go to? Are you able to show your screen or anything that the folks can opt into just so they can get an idea of where to go to kind of kick off their trial?
Okay. Something?
Bobby, that's a really good question about play therapy. Is that, I guess, the focus of your service lines, or is that just a small portion of it, Bobby?
Let's say that can you hear me okay? I'm on my AirPods. Okay,
Yeah,
perfect.
you sound great, Bobby.
In my practice, I would say we probably do about 30 to 40% of our clients are kids. And so we do spend a lot of time in our playroom, or utilizing, play-centered activities within our offices.
Hmm. Yeah, we do have customers that are using the platform, Bobby, for that. What I found more often than not, it's because there's such a lot of silence that's happening. It ends up leaning over a bit more to the dictation side for just kind of recapping that. Again, I think it deals with the verbal cues that are in the environment. So if you have in the play therapy session, it's a lot of chitter chatter for maybe older kiddos versus maybe a lot of kids that maybe don't speak too much. We found dictation has been the best way to kind of talk about what was experienced in
Okay,
that play therapy session. So hopefully that helps you.
that does. Thank you for that. I appreciate it.
Yeah, you're welcome, Bobby.
Okay. Do you see TherapyMate now?
I can see it. Yeah.
Okay, so to get to the settings that I described earlier, the system admin would click on their name at the top corner, go to settings, scroll down to practice settings, and then right here it says manage clinical notes AI. And this is the place where you can see the different subscription plans for AI. It'll describe the limits of the live sessions versus dictation. Dictations are always unlimited. And then to enable one of your staff members or yourself, you pick a plan, and then you click the subscribe button, and that's all you have to do. You're ready to go.
Bobby, in your use case, if you end up trying this out and you're spending majority of your time doing your dictations only, as Don mentioned, every tier that you subscribe into has unlimited dictations. It's going to be the live session credits that we mentioned that are the major differences between the tiers. Just things to keep in mind. So you might want to start at a lower tier level, Bobby. It just depends on how often you're going to use that particular live session over the course of a month. Credits reset every month.
Great. Thank you for helping me understand that.
Yeah, yeah, yeah. And Holly's got to take off, and we're coming to the end of the session today. I'm going to give one last poll for everybody. If you're able to do a quick review of that, basically asking a few questions about are you ready to kind of get started? If there's any other questions, we'll have some follow-up, which will include the recordings from today. And we'll also have some videos that will help you answer hopefully any questions operationally about how to get consent going, how to get signed up. And then Catherine, I will go back and look at the chat and see if you were able to leave your number in the chat there, or I can email you directly. I think we have your email as well, Catherine. So Don, you may have to help me out with that with Catherine, okay?
Yep.
That's all right? Okay. All right. Well, again, we thank everybody for your time and the services that you provide for your clients and people. So again, thank you so very, very much for today. And if you have any questions, we'll be here for you.